Welcome to the KQT Health Learning Management System lesson for Hospice Transport Policy for Pennsylvania EMS staff. Please make sure your device volume is appropriate to allow you to hear the materials as they are presented. This lesson will present material covering the Keystone Quality Transport Hospice Transport Policy. This program is specific for Pennsylvania EMS staff. Providers from other states are not required to complete this training program but are welcome to do so, as this lesson contains information that may be valuable for you as an EMS clinician. Topics that will be discussed in this presentation include: what is hospice? Pennsylvania Out-of-Hospital Non-Resuscitation Act of 2006, Pennsylvania EMS, BLS Protocol 324. Out-of-Hospital Do Not Resuscitate Orders, Pennsylvania EMS, Out-of-Hospital Do Not Resuscitate Form, Pennsylvania Orders for Life-Sustaining Treatment Form, Keystone Quality Transport Pennsylvania Hospice Transport Policy. A printable copy of the Hospice Transport Policy is available on the Employee System portal. What is hospice? Hospice care, sometimes called palliative care, is a type of healthcare that focuses on making a terminally ill patient comfortable during end-of-life care, by managing their pain and symptoms, and attending to their emotional and spiritual needs. A terminal illness is an illness or condition which cannot be cured and is likely to lead to someone's death. Only a person with a terminal illness is eligible for hospice care. Generally, the life expectancy for a terminally ill patient is 6 months or less. When a person elects to start hospice care, they are choosing to stop treatments in order to cure or improve their diagnosed terminal illness. All care and treatment will focus on making the patient comfortable during the end-of-life process. Important: treatments related to acute conditions that are not related to their hospice illness can, should, and must be treated. As an example, if a hospice patient who has a terminal illness of lung cancer falls and receives a laceration or fracture, those injuries would still require and should receive immediate medical care, including EMS care and transportation. If that same patient with lung cancer developed an acute case of shortness of breath that was related to their terminal diagnosis, that patient would not receive care beyond comfort care. Respite care is a special type of hospice care for home hospice cases. There may be times when the usual family member caregiver needs a break from providing care in the home to their loved one. In these cases, a short-term, inpatient hospice admission can be arranged by the patient's care team. Normally, respite care is limited to 5 days, but a patient can have multiple respite admissions. The Out-of-Hospital Non-Resuscitation Act of 2006 is the law that lists the criteria to obtain an out-of-hospital DNR, identifies who may request an out-of-hospital DNR, allows EMS providers to withhold resuscitation when an out-of-hospital DNR is presented for the patient in cardiac or respiratory arrest, identifies who may revoke the out-of-hospital DNR, explains the criteria for issuing an out-of-hospital DNR to a pregnant patient. The Pennsylvania EMS protocol regarding out-of-hospital do not resuscitate order is permitted by this law. Under the Out-of-Hospital Non-Resuscitation Act of 2006, a person may request an out-of-hospital do not resuscitate order for themselves if the person has an end-stage medical condition, who is competent at the time of request, and is 18 years of age or older. The out-of-hospital DNR order may be revoked by destroying or not displaying the order, bracelet, and/or necklace, or by conveying the decision to revoke the order verbally or otherwise at the time the patient experiences cardiac or respiratory arrest. If the patient obtained the out-of-hospital DNR order for themselves, only that patient may revoke it. If a surrogate, meaning another person, obtained the out-of-hospital DNR order, the patient or the surrogate may revoke the order. The patient's mental or physical condition does not limit the patient's right to revoke the out-of-hospital DNR order. The Pennsylvania Statewide Basic Life Support Protocol No. 324 is the out-of-hospital do not resuscitate directive to be used by EMS providers responding to emergency call for assistance. This protocol is only applicable to pre-hospital patients in cardiac or respiratory arrest that have an original out-of-hospital do not resuscitate order form, bracelet, or necklace. The Pennsylvania out-of-hospital do not resuscitate form will be discussed in more detail later in this lesson. If the patient does not have a Pennsylvania out-of-hospital do not resuscitate form, bracelet, or necklace, and one cannot be produced by the patient's caregiver, this protocol cannot be used. Only the Pennsylvania out-of-hospital do not resuscitate form, bracelet, or necklace can be honored using this protocol. The Pennsylvania out-of-hospital do not resuscitate form is not the only DNR form you may encounter as an EMS provider. Other types of forms include advanced directives, living wills, DNR, forms from online or commercial services, and the Pennsylvania Orders for Life-Sustaining Treatment. Caution: the Pennsylvania Orders for Life-Sustaining Treatment, also known as a POLST form, is an official Pennsylvania Department of Health document. However, it is not acceptable under this protocol in lieu of the Pennsylvania out-of-hospital do not resuscitate form. The Pennsylvania Orders for Life-Sustaining Treatment form will be discussed in more detail later in this lesson. These other types of do not resuscitate forms, including the Pennsylvania Orders for Life-Sustaining Treatment form, can only be honored if they are validated by a medical command physician. If a pre-hospital patient presents in cardiac or respiratory arrest, and you are presented with one of these other types of DNR forms, you must initiate CPR resuscitation efforts, while medical command is contacted. If the medical command physician authorizes, resuscitation efforts can be stopped and the patient allowed to expire. In accordance with the Out-of-Hospital Non-Resuscitation Act of 2006 and the Pennsylvania EMS BLS Protocol 324, the patient or the patient's surrogate can revoke the DNR at any time. If the out-of-hospital do not resuscitate order is cancelled by the patient and/or the patient's surrogate, you must initiate CPR resuscitation efforts. Important: if the patient or the patient's surrogate rescinds the out-of-hospital do not resuscitate order, be sure to document the name and relationship of the individual that cancelled the DNR order. The procedure for using Pennsylvania EMS Protocol 324 is: upon arrival on scene, verify the presence of a valid Pennsylvania out-of-hospital do not resuscitate order, bracelet, or necklace. Verify that the patient is pulseless or apneic. If a bystander has already initiated CPR, assist with CPR and contact medical command immediately. If CPR has not been initiated before your arrival, the out-of-hospital do not resuscitate order shall be honored and CPR shall be withheld. If there is any question of whether the out-of-hospital do not resuscitate order is valid, or the patient or their surrogate has revoked the order, or whether the patient is pregnant, the EMS practitioner shall initiate resuscitation efforts and contact medical command as soon as possible. The out-of-hospital do not resuscitate order is of no consequence unless the patient is in cardiac or respiratory arrest. If vital signs are present, the EMS practitioner shall provide medical interventions necessary and appropriate to provide comfort to the patient and alleviate pain unless otherwise directed by a medical command physician. A do not resuscitate order does not mean do not treat. You must provide appropriate non-resuscitation medical care for all patients that have a pulse and spontaneous respirations, regardless if they have a do not resuscitate order or not. The only DNR form that an EMS provider can honor automatically without further direction is the Pennsylvania Department of Health Out-of-Hospital Do Not Resuscitate form. Any document that is not the Pennsylvania Department of Health Out-of-Hospital Do Not Resuscitate form, including advanced directive, living will, facility DNR form, Pennsylvania Orders for Life-Sustaining Treatment, requires contact with medical command in order to honor the do not resuscitate order. The form must be an original, meaning that there is an actual signature on the form itself. A photocopy of the completed form cannot be honored. If you are presented with a photocopy or a digitized version of the completed out-of-hospital do not resuscitate form, you must contact medical command to honor the request. Section 1 of the form is for the patient's name. A healthcare facility may place the patient's identification or demographic sticker on the form instead of writing the information by hand. Section 2A of the form is for the attending physician's statement and signature. The physician must sign, print their name, and date the form. The Pennsylvania Out-of-Hospital Do Not Resuscitate form does not have an expiration. Once it has been signed by the attending physician, it is valid until the patient's death or until revoked by the patient, or their surrogate if applicable. There is a space for an emergency phone number to reach the physician, but it is not mandatory that this be included. Section 2B of the form is for the attending physician's statement for pregnant patients. After additional counseling and additional end-of-life planning, the physician must complete and sign both sections 2A and 2B, in order for the out-of-hospital do not resuscitate order to be valid when providing care to a pregnant patient. If there is any concern about the pregnancy status of the patient or the validity of the do not resuscitate order, contact medical command immediately. Remember that a do not resuscitate order is only applicable if the patient presents in cardiac or respiratory arrest. Any and all illness or injury, when the patient has a pulse and is breathing spontaneously, should be managed based on appropriate EMS scope of practice and protocol for your level of certification. Section 3A is for the patient's signature. There is a space for the date the patient signed the form and a space for their signature. The date of the patient's signature may be before the attending physician's signature. This can happen when the patient signs the form to request the out-of-hospital DNR and the attending physician then signs at a later date, after examining and counseling the patient. Remember, if the DNR was requested by the patient, only the patient can revoke the DNR order. A family member may not revoke the DNR order. Section 3B is for the patient's surrogate signature. If a patient is mentally or physically not capable of requesting and signing the do not resuscitate order, a legally authorized surrogate may do so and then sign the form. There is a space for the surrogate's relationship to the patient in the surrogate statement. This should be filled in. There is a space for the date of signature and space for the signature itself. Remember, if the DNR was requested by a surrogate, the patient or the surrogate can revoke the DNR order. Only the patient or the signing surrogate can revoke the DNR, other family members may not revoke the DNR. This image shows the Pennsylvania out-of-hospital do not resuscitate bracelet and necklace placard. If the patient is wearing one of these items, they can be accepted as the do not resuscitate order even in the absence of the form. There is a space on the out-of-hospital do not resuscitate form to indicate if the bracelet and/or necklace have been issued to the patient. If the form indicates that the bracelet and/or necklace have been issued, they should be placed on the patient to wear. Both of these items have spaces for the attending physician's name, date, and signature. A downloadable sample of the Pennsylvania out-of-hospital do not resuscitate order form is available with the lesson material on your learning management system. The Pennsylvania Order for Life-Sustaining Treatment form, also called a POLST form, is often used in medical facilities, both acute care hospitals and nursing homes. The POLST form is not an alternative to the out-of-hospital do not resuscitate order. The POLST form is meant to make a patient's care choices known to in-facility healthcare providers. The POLST form is signed by the patient's attending physician and is part of their medical chart as physician orders. The POLST form is easily recognized by its bright pink color. The POLST form contains sections to identify the patient's desire for medical care in the following areas. Section A is for if the patient goes into cardiac or respiratory arrest and indicates whether or not CPR should be performed. Remember, the POLST form is not an alternative to the out-of-hospital do not resuscitate form. If the POLST is marked no CPR, you must contact medical command to obtain permission to follow the direction provided in the POLST form. Sections B, C, and D are for medical care when the patient is not in cardiac or respiratory arrest. The medical actions in these sections are generally outside of the scope of practice for EMS providers, but the information may be helpful for you in determining what other care to provide when the patient is in your care. It cannot be stressed enough, the POLST form is not a substitute for the out-of-hospital do not resuscitate form. At the top of the POLST form is a black box warning for facility healthcare providers and a reminder for EMS providers. In order for an EMS provider to follow the directions of the POLST form, they must contact medical command. Keystone Quality Transport is the medical transport partner for several Philadelphia area hospice programs. Keystone Quality Transport provides medical transportation services to the patients of our partner programs. These partner organizations rely on Keystone Quality Transport to complete transport assignments quickly, safely, and efficiently. The patients of our partner organizations are entering end-of-life care and must be treated with the utmost respect and care. This may be a difficult time for the patient and their family members. It is your responsibility to provide the highest level of customer service in order to make them feel comfortable and well cared for. The Keystone Quality Transport Hospice Policy is only applicable to patients that are part of a hospice program provided by one of our partner organizations, that are being transported for hospice-related services. The presence of a Do Not Resuscitate order does not automatically mean that the patient is part of a hospice program or that they are being transported for hospice-related services. Your dispatch notes will indicate if the patient is part of a hospice program. The call type will be classified as hospice. If you are completing a transport of a patient that has a DNR but is not classified as a hospice case, you should follow all appropriate EMS protocols and company policies. Confirm, using your dispatch notes, that the current call is for a hospice case. The call type will be classified as hospice. If there are any questions about the call type and whether the current run is a hospice case, contact dispatch immediately for clarification. Ask for the Pennsylvania Out-of-Hospital Do Not Resuscitate form. We have worked closely with our hospice program partners to develop procedures and training for their staff with Keystone Quality Transport's expectations for patient care transfer, including having appropriate documents completed and available at the time of transport. Review the Pennsylvania Out-of-Hospital DNR form to see if the DNR necklace and/or bracelet have been issued to the patient. This will be marked in Section 2A of the form. If these devices have been issued, make sure they are being worn by the patient. Obtain a copy of the Pennsylvania Out-of-Hospital DNR form. You will need to submit a copy of the form with your other end-of-shift required paperwork. If the patient does not have a Pennsylvania Out-of-Hospital DNR form, and the facility is unable to obtain one, for the transport, you must contact the clinical director immediately. The transport of the patient will still continue. However, if the patient goes into cardiac or respiratory arrest, they will be treated as a full code, with all resuscitation measures provided. Important: do not argue with the facility staff or family of the patient about the care treatment status of the patient. When that patient is in your ambulance, you must follow all treatment protocols. If the facility or family is unable to produce the proper DNR documentation, you shall complete the transport as scheduled and treat the patient according to all applicable EMS protocols. If you are presented with a DNR document other than the Pennsylvania Out-of-Hospital DNR form, including a POLST form, ask if the Pennsylvania Out-of-Hospital DNR form is available or if one can quickly be obtained. If the Pennsylvania Out-of-Hospital DNR form is not available, the transport will be continued with the other DNR documents provided. In the event the patient goes into cardiac or respiratory arrest during the transport, you must contact Medical Command in order to follow the documented desires of the patient. Like hospice care in general, the goal of medical transportation during the hospice transport is to make the patient comfortable during end-of-life care. Here are a few items to consider as you provide care and transportation to the hospice patient. Use gentle techniques when lifting and moving a hospice patient. Their debilitated condition may leave them in a weak and frail physical state. Try to avoid moving the patient by using hand carries, in which you are required to grasp their extremities. It is better to use slides and drags for these patients. Hospice patients at the end of life may experience discomfort from bright lights and loud sounds. You should turn down the lights inside the ambulance and keep noise from radios and phones as low as possible. It is not uncommon for patients in hospice to emaciate, because of losing muscle mass and body fat. Be sure to pad the stretcher, stair chair, and any other devices used to move the patient so that contact points on their bodies do not cause pressure sores or injuries. Another effect of losing muscle mass and body fat is a decreased ability to regulate body temperature and warmth. Consider using extra blankets to keep the patient warm, even during warm weather periods. Remember, a person in the advanced stages of dying may not be able to communicate physical needs. You will need to rely on visual assessment cues as to what your patient needs. Finally, one of the most important care aspects of transporting a hospice patient is to treat them with dignity and respect. In addition to experiencing a wide range of physical symptoms, They are likely having many emotional needs as well. Be compassionate. Hold the client-patient's hand. Human contact is a crucial part of end-of-life care. If the client-patient with a valid Pennsylvania out-of-hospital DNR form is being transported to a private residence for home hospice care, expires during the transport. Stop your vehicle in a safe location. You will need to perform a physical examination to confirm death. Confirm the absence of a pulse and respirations. Document the time of death. Be sure to assess the carotid pulse. Distal pulses like the radial pulse may be difficult to detect in a client patient that is in an advanced end-of-life state. Notify KQT dispatch immediately. Be sure to inform the dispatcher of the time of death, so that it can be documented in the computer-aided dispatch system and the call notes. Transport the body to the closest emergency department. If the client patient with a valid Pennsylvania out-of-hospital DNR form is being transported to an inpatient hospice center, expires during transport. Follow the same general steps as just previously described. Stop your vehicle in a safe location and complete a physical examination. Confirm the absence of a pulse and respirations. Document the time of death. Notify KQT dispatch immediately. The KQT dispatcher will contact the receiving facility to determine if the deceased can be brought to their location. If the receiving facility cannot accept the deceased, transport the body to the closest emergency department. If the client/patient with a valid Pennsylvania out-of-hospital DNR form is being transported out of state, to either a facility or private residence, contact the clinical director prior to beginning the transport, to determine if there are any special instructions or procedures to follow. It is important to remember that every state has different laws and regulations regarding hospice patients that expire during transport. The clinical operations team will help you determine the most appropriate actions to take in the event your client-patient expires during transport. If you have any questions about the Keystone Quality Transport Hospice Transport Policy or concerns about a hospice transport case, contact the clinical operations team immediately for clarification and guidance. Thank you for taking the time to view this KQT Health Learning Management System presentation on the Keystone Quality Transport Hospice Transport Policy. If you have any questions about the contents of this presentation, please contact a member of the clinical operations team. Please complete the associated quiz for this lesson in your Learning Management System employee portal.